Welcome. Thank you for joining us for this week's cross-industry session that looks at the Safer at Home updates, any information that you need to have, opportunities for you to ask questions. Again, because it's cross-industry, some of the answers may be specific to one industry, but we're trying very hard to make sure that we clearly state when this answer is specific only to one industry. Do not be afraid to ask your questions. If they can't be answered on this call, we'll follow up afterwards. We're going to continue to have these opportunities in these weekly sessions for the near term. And in the interim, between the weeks, please reach out to us with any additional questions, feedback, or information. At this time, I'm going to hand it over to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. And I'll jump right in. Thank you so much for joining us. And again, as always, thank you, Corinne, and thank you to the Boulder Chamber for hosting these. Just jump right in here. So what I'm going to talk about is we're going to spend some time with some statistics regarding the current state of the pandemic, both nationally and in the state and also locally. Then we'll go over the public health order and the face covering orders, and then really get into what this means for businesses and how Boulder County can help. And then we'll jump into Q&A. And as Corinne said, we're happy to answer any questions. And we'll make a point of saying if the answer is sector specific. So I want to start with the 3-day running average of COVID cases, new COVID cases in Colorado, as reported. I believe it was up until Monday. This is, really, I just wanted to point out the trend. As you can see, since June, it has been trending up. And that is the same for us. We had that big spike in mid-June, but even though it's come down and we're now currently seeing a downtrend, we're still steadily overall seeing an upward trend in new cases. And I think that that's an important thing to keep in mind as we discuss how important it is to adhere to the public health order and the mask orders. Now, these next couple slides, they come from a Google study that they basically have been looking at trips and access to various types of businesses. And this is going back to February of this year. And the middle line, 0, is, I guess it's not middle in either of these graphs, but in the graph I was looking at before, it was the middle. But you can see 0 is sort of the standard baseline that existed as of the middle of February, before all of the public health orders came into effect. And then you can see, in terms of number of trips, the significant drop off under stay at home, and then the slow return. We're still well below in workplaces, obviously, at 50% occupancy, and encouraging, or businesses encouraging people to work from home. That's likely to happen. Under retail and recreation, and I apologize, this is a funny grouping to me. I don't know why you would combine those two, but I think it's gyms and retail is sort of what this is. But again, you see that large drop off and you see a slow return almost back to normal. And then parks is an example of one where we're seeing obviously lots of return. And I think what I wanted to show this for was we are seeing a return to these quasi-public spaces where we're interacting with each other. And as we see that return towards normal interaction levels, we're also seeing that uptick in cases. And I think that that's really important. And that has to do with, or that connects to this projection, which comes from the Colorado School of Public Health. And what they did was they looked at current modeling, a number of models, both national and local. They plugged in levels or rates of social distancing and looked at what the impact would be on hospitalizations and ICU needs. And one of the things that we're tracking, that the state's tracking, that they're tracking at the national level, is this number of ICU beds in the state, in the country, and at what point we could overwhelm that need or that availability. And under the current, under some low levels of social distancing, and we're actually at about 55, I think is where we are. And Lane, you can correct me if I'm wrong there, but that's my understanding is 55 or lower.
We're at.
Oh, okay. Sorry, 41. In that case, look at the orange line, and you can actually see that in August, in a month, we are projected to be over our ICU bed capacity. And that's a worrying trend. And so, these are just reports, they're trends. We don't know, this can't be guaranteed, but these are projections based on modeling. And I think the reason I bring them up is we need to be aware of how our actions really impact the larger state public health situation.
Jesse, could you please speak up? We've gotten a request that you speak a lot louder.
Absolutely, I will do my best. So with all that said, I think I want to jump from sort of our projections and our current status to from a public health perspective to our public health orders and masking orders and where we are in that process. And really just, in the last month, we haven't seen much change with the public health orders. However, we have seen significant change in masking orders. At the end of last month, the county extended our facial covering order indefinitely. And then on July 16th, the state issued their face covering order, and I'll go over those in a moment, and also issued a pause on variance applications for 2 weeks, which would be the beginning of August. And I haven't heard any updates on whether that's going to be extended at this point. In terms of where we are from a public health order perspective, we are still under safer at home. We entered safer at home in May. It's been adjusted over time, and that adjustment has really led to the point where many businesses are now open at recognized reduced levels. And I linked to this. When this presentation goes out, you can click on that link, and that goes to sector-specific guidance, which I think we really want to keep hammering. People should definitely go check that out. And I think the important thing, again, that I want to point out here is even as we are seeing businesses open, the state is still cautious about what can remain open. Bars were open for a little while, and then we saw an uptick in cases, and the governor made the choice to close some bars that didn't have food service. And arcades and amusement parks haven't been open at all. And I think it's just, I point that out in order to really get across the point that we're in a situation here where the governor and the public health officials are really trying to figure out a way to open up safely. And we're doing it cautiously. As you can see from those trends that I showed you, caution is really important. The more cautious we are, the lower we keep those cases, and the better off we are in the long run. In terms of face covering orders, again, statewide face covering order is in place for 30 days, so that would expire in the middle of August unless the governor extends it. The county face covering order is in place indefinitely, and there are a number of local face covering orders. I'm off because it looks like I'm unstable. My connection is unstable, so sorry about that. And so if you are a business in any of those localities, please do check with your locality to see what the requirements are. The caveat for all of that is, in any situation, look to the strictest face covering order for your direction on what to do. In terms of the state and county orders, we have adjusted our face covering order. Boulder County has adjusted the face covering order to come into alignment with the states in a number of situations. For one, everyone over the age of 10 must wear a facial covering. Indoors, in public spaces under the state order, and outdoors if social distancing cannot be maintained. That's from our order. In terms of the consequences and sort of the guidance from the state order, I wanted to quote from this section. No owner, operator, or manager of a public indoor space may provide service to or allow an individual to enter unless that individual is wearing a face covering. That's pretty clear, and the only exemption is for medical reasons. Another thing that I really want to point out here is businesses must post signs at the entrance to their business noticing their customers that face coverings are required. And the consequences under the state order are that a business can lose their license for failure to comply. And I don't say that to frighten people. I say it because that's the consequence that the state has levied there. And we want to be the source of how to comply. And so I think really what we're looking for is that you inform your customers. This mask sign is actually available on the state's website. Once again, if you get this presentation, if you click on this mask sign, it'll take you to a place where you can print the sign, post it on your front door. And in terms of what to do when facing customers who can't or won't wear a mask, the state encourages, and we encourage you to find alternatives, whether that be curbside pickup or online ordering. And the state issued civil rights guidance a number of weeks ago that basically says that businesses can deny service to those who can't or won't wear masks, and they're protected in that, as long as you're offering alternative access to that. And really, for details, I wanted to link to the state mask guidance. It's set up like a frequently asked questions. You can go through and say, what about sports? Can people who are participating in sports wear masks? What about going to the gym? All those sorts of questions are covered in greater detail in the state mask guidance. And I really want to encourage you to check that out. And that is updated as they add more details. So all that said, what does this mean? Well, I feel like it means that we need to work together to reduce the spread of COVID-19. The same things that we've been saying and leaders have been saying from the beginning in terms of how to limit the spread of this: wash your hands, maintain physical distance, and wear masks. Those are the ways that we can reduce this, and really adhere to your public health orders. I think it's really important to recognize that where we are right now is, we're in the summer, people are outside, people can get outside, people are traveling, getting away from crowded areas. As we enter the colder months, that's going to change. In addition, kids are going back to school. CU will be back in session soon, and we're working as hard as we can with CU and with the school districts to protect those communities as well. But if we're here now, what happens in the future is really up to all of us working together to see where we can get. And that leads to the chart that we've been showing a ton for the last couple of weeks. Think about the activities that you're participating in. What impact do they have on your safety and the safety of those around you. Not to say that you can't do these things, it's just be aware of how your behaviors impact you and those around you as you go forward. In terms of how we can help, how Boulder County Public Health can help, well, this webinar is an example. We want to share information as much as we can, as widely as we can. We want to interpret the orders to try and help you operate. We can enforce the orders, and we have been. We also want to provide outbreak guidance. If you if one of your employees has gotten sick, call us. We can walk with you through what needs to be done to protect your other employees. Our department will also reach out to your sick employee and work with them, but we want to be there to help you address your concerns. And then we also provide resources like access to CDPHE and our own information on our site. Switching gears again, I just want to give a little update on Protect Our Neighbors. We are, as a community, we need to apply to enter Protect Our Neighbors. We do not qualify at this time. But I think hopefully last week the county released a website that tracks how close we are to qualifying. And at some point we're going to have to, public health and the commissioners and the communities will have to make a decision about whether we want to move to there. But at this stage, we are not there yet, and so we couldn't even apply yet. With that, I think I just want to go over some common Q&A. In terms of guidance on mask enforcement, we on our website have a mask script that's available through that website. We also, I linked earlier to the civil rights guidance, and I really recommend you check that out. We really want to ensure that you have the tools you can to talk to your customers and not leave it up to chance that just one random employee runs into someone who's not wearing a mask. Proactive enforcement is really going to help here. As I mentioned, with outbreaks and with sick employees. So if you have a sick employee, definitely check out the outbreak guidance, and we will walk you through what needs to be done as well. And I think another common question we've been getting a ton is specific to offices, and it has to do with, do I have to wear a mask if I'm in an office space, cubicles, and I have other coworkers, but I'm socially distanced from them. And you do have to wear a mask in that situation. Cubicles do not protect against, they're not a barrier. And the mask order is clear that indoors, you need to be wearing a mask. With that, just want to remind everyone, we're going to continue to have these 3 p.m. general updates. We're going to try and continue to craft them to appeal to the largest group of people, but also be here to answer specific questions. Wednesday at 4 p.m., so in another hour, we'll be having special sessions that will be decided in advance. This week, so at 4 p.m. today, we'll be talking about recreation. And then Spanish language sessions are in collaboration with the Latino Chamber, and they're released on Thursdays. If you want to sign up for any future session, please go to the link at the bottom of this slide. And with that, if you have any questions, please email us. If you have complaints, call the call center, and happy to answer any questions. Thanks for listening.
Thanks, Jesse. Sorry, your internet was unstable again. So we're just envisioning what you look like right there while you're answering these questions. So I think we've had a couple questions about enforcement. What is currently the enforcement policies on masks, public spaces, or within a business? How are you able to enforce some of these mask orders?
Sure. So It is based on the state order. It is up to the business itself to enforce the mask order on their property. What public health can do is work with a business to try to increase signage, talk to management about how to communicate the mask requirement. But in terms of enforcement from us, we actually enforce against businesses that don't comply. We're not going to enforce against individuals who don't wear a mask. We don't have that capability. It's a little too small-grained to really get at individuals who aren't wearing masks. So what we want to do is help you enforce the rules that the state is requiring.
Okay. So specifically, we've seen this as well, where we have, one company will say, I heard that the state's now allowing this, and another company is like, well, is that the case? Where's the go-to site to really get those answers, or what should you do before you take, some of those, in some cases, rumors into action as a business?
Right. I think the first place to look is that CDPHE guidance document. Going to covid19.colorado.gov can give you some idea. But if you are hearing from other businesses in your sector that there's been a significant change, contact us. We're in touch with, through our attorneys, we're in touch with the state on a regular basis, pretty much daily. And we're trying to interpret any changes that are coming up from the state. And so I want to encourage you to get in touch with us before you make significant changes to your operation based on something you've heard from another business. There are certainly situations where we're finding out about things the same time you are, but I think it's really important that we try as a community to come up with the same answer together.
Thank you. And one of those recommendations is get your answer before you publicize to your customers, just in case it's incorrect and you have to turn that around and tell them again, oops, not really the case. So,
Absolutely.
So this is maybe a question, I don't know if one of you can answer, but what type of temperature testing processes have been seen implemented around the country that are more automated versus a staff temperature testing station that are working well? So maybe talk about some of the options for temperature testing, and then I can talk about a few of the best, like some of the new technologies that are out there.
Lane, I don't know if you have any guidance on that from the restaurant world who've been.
No, I'm not aware of a lot of automated pieces. I think it's really pretty individual temperature checks, as well as overall symptom check. That's just one of the symptom check pieces. So I don't know if people are thinking something where it's reading people's body temperature as they're walking in. I don't know of anything that's going to be reasonable, affordable. Really, just those simple temperature gauges are what we're looking for. Usually, it's that surface temperature in the middle of the forehead. I think that's typically what airlines are doing for all passengers that are flying, and so that's, I think, still probably the most reasonable way to at least be doing employee temperature checks. Again, there's a whole list of symptoms that you should be screening for because everybody presents a little bit differently.
Yeah, so there's been recent news and stuff about some local businesses and companies that have added more of a thermometer onto a robot type thing. There are those. My son, my 11-year-old, there are more of those types of situations as well. So there are companies that are trying to present kind of a system where an employee can walk in and it takes their temperature as opposed to someone holding the thermometer. But those, as Lane said, are probably pretty pricey because it is new technology and not something that a lot of companies were doing in the past. So this question says, what should you do or say when you hear that all of this is a conspiracy theory? Now, the person does want to clarify that they don't believe this, but it comes up in conversation, especially when you're dealing with others.
Yeah, I mean, we're only watching data. I mean, there's certain pieces that Jesse talked about and showed you that is modeling. So that's not saying this will come to pass, but it is looking based on the data we have and the likelihood of, if things persist, where they will go. But it's not a conspiracy. I mean, I don't know how you address anybody who has conspiracy theory kind of focus. So it's really a difficult conversation. If it's someone's opinion, you're going to have a hard time changing it. So we're just focused on where we're at, what our data is showing. Currently, again, the trends that we're on, we need to kind of back that off. We need to see those case counts come down so that we aren't continuing to potentially stress the healthcare system, especially for our ICU needs. So that's what we're focused on. And I don't even know how to otherwise advise you to address that.
That's a tough one.
That's a hard one. Yeah.
Well, because, a lot of our businesses are, on the front lines of dealing with patrons and masks and having to enforce public health orders within their businesses. So you're hearing a little bit of everything, and we see it on the news and we see it in social media, but you're also hearing it in your businesses. So I know that there's a recognition that that's the case. I'm not sure there's a perfect answer for that from anybody on this call, but
I think that, again, Jesse really had the slide that's probably the most pivotal public health prevention steps of washing your hands, staying home when you're sick, socially distancing, and wearing masks. All of those are within the control of each individual. If you're not able to wear a mask, that's where businesses have to look what's a reasonable accommodation they can make. But that is just it. It's a reasonable accommodation. It doesn't mean you need to come up with and completely alter your business to accommodate people. So it's reasonable accommodation. And if there's no reasonable accommodation that can be made, it still does not allow people who don't wear a mask to be in your business. So again, Jesse talked about restaurants and retail where you can offer online and curbside or delivery. Those are all reasonable accommodations. When you get into a gym, unless you're willing to have dedicated space with maybe dedicated hours, it's going to be a lot harder for you to allow people into your business that aren't wearing masks. So, but there is no caveat that allows those people to come into the business without a mask. There are just some exemptions for people who do not have to wear a mask, but it doesn't give them free rein to go into any business because they are not able to wear a mask medically.
So we actually had some feedback from some of the people on the call as to what you can also say. Some businesses are saying, we can't be open unless we follow these strictest guidelines, and kind of pushing it off a little bit, but this is what we need to follow, and we don't want to lose our business license, and we need to follow these orders to stay open, especially these strict guidelines.
Then the biggest piece of that is, and feel free to say, this is the law. We didn't make the law. We may not like it. You can offer all your own opinions about that. This is very simply the way to allow businesses to be open and successful. And that's really critical for us to do. But there's a line, that we can't keep crossing. And, we showed you some of the trends. So we want you to be successful. So having people wear a mask is a very simple thing for them to do. When you're working out, it makes it a lot more challenging. So really that starts to push people to be outside or, finding ways to really not be around other people. We're going to work with the state to see if there's any willingness for them to modify their orders. But until then, we're subject to the state law as well. And so we can say the same thing. We don't necessarily like how all the state laws have been written. They weren't crafted with our guidance and advice, but they are still those state orders and state laws.
Okay, thank you. And then someone made the comment that maybe a field trip to an overflowing ICU in one of the other states could debunk conspiracy theory. Not a practical solution, but just a comment made by someone on the call.
There is another outreach effort. Our information folks are really trying to work because we know behavior change is always one of our biggest challenges in public health. So this mask and social distancing is a significant behavior change for our entire population. But really telling the stories of the people who've gotten sick, especially a lot of the businesses, your employees are at high risk when people are coming in not wearing masks. So, you know, those frontline staff are people that we are trying to protect, and hearing the stories of people who've gotten sick and some have passed away because they were out there providing services and the public, you know, was again coming in while they were ill, not wearing masks. So there are real faces and real stories of who's been impacted by this. So it is not made up.
Thank you, Lane. I know that that's a difficult question, but I think, you know, covering a couple pieces that could be practical things you can say as a business. Now let's shift gears a little bit. We have a question about basically the fairgrounds, and I think a lot of the larger event facilities. What criteria would need to be met for like the county to open the fairgrounds to events, for example?
So I'm not sure about the decisions for the fairgrounds specifically, but events can occur under the current order. There are, you know, safeguards and limits on the size, how many people can attend, and what kind of parameters need to be in place. There are certain types of events that probably won't occur. For the fairgrounds specifically, you know, I'm not sure I have a good answer. We may have to look into what other decisions are being made related to the fairgrounds, but 175 is the current maximum. So when you're thinking of events that would be in excess of that, those would not occur. So again, a large venue like the fairgrounds is typically used for events when you're going to have a lot more people. So,
yeah, I think. Oh, go ahead, Jesse.
Sorry, no. I do know that there are ongoing conversations. You know, it really, I think a lot of the fairgrounds type events or activities really depend on, as pointed out by the questioner, the exhibit building that it's taking place in, whether that be one of the buildings that's all indoors, or if you're doing, you know, livestock judging in one of the open areas, you know, that's going to change some of the dynamics. But as Lane said, 175 is your limit. So that's really, it may be that the fairgrounds management is saying that having larger events is just not possible. And so we're going to limit the spaces that it occurs in so that we're economical about the spaces we use.
And I believe there were discussions looking at 4-H and allowing kids to be able to show their animals and things like that, but it wouldn't be a public fair where you're going to get large crowds coming through. So I know there are discussions to do certain things, but again, sort of like a fair where we would maybe have thousands of people, something like that is still not likely to happen for a long time.
Well, and this relates to more than the fairgrounds. You know, a lot of the local chambers normally have your peach festival or your oatmeal festival or your beer festival, or there's a lot that goes on over the summer that isn't able to go on because, you know, it's not profitable to do it with only 175 people, or it's just not the type of event it is. Right. I think a lot of people are still looking to see if you guys have a crystal ball as to whether or not they can book out September through December. And I think, you know, that's across the board. Do you have any gut feelings about any of this changing, say, September through December?
I don't. It really, you know, I think when we look further down the road, even next month, with schools reopening, universities potentially having in-person classes, we're going to see our social distancing maybe reduced from where it is now. So that's, again, why when Jesse was showing you those kind of percent social distancing, we do want to see those numbers increase because we know what major events are coming in the future. So we are concerned about what, you know, potentially happens with schools. Flu season is going to be starting around that time. So we're concerned about what that season could look like. Again, if people are taking all the precautions for COVID, those are the same precautions to protect you from the flu. So we hope it's a mild season. But again, those are the same resources when you're looking at ICU and ventilators that get in demand for people that are hospitalized for other respiratory situations. So we don't really have anything other than we're very cautious about where we're headed towards the end of the year.
Do we have any more questions out there? I'm going to ask that question as we're closing up this one. Now, again, I know Jesse, you covered this in the presentation, but we do get a lot of these questions because the mask order says public spaces, and that then opens up the questions of offices and manufacturing and some of those other types of businesses that they don't see themselves as public spaces. Can you reiterate again how the mask order affects those types of businesses?
Yeah, so any place where people from outside your house, I'll start by saying the way I would think about it if I were you is any place where people from outside your household are going to be in contact with each other inside a building, consider that a public space. But I can also read to you directly from the public health order, the mask order at the state level. So public indoor space means any enclosed indoor area that is publicly or privately owned, managed, or operated to which individuals have access by right or invitation, express or implied, and that is accessible to the public, serves as a place of employment, or as an entity providing services. So it's very broad. It's basically everything except for a private home is how I would think about that. In fact, it says, public indoor space does not mean a person's residence, including a room in a motel or hotel or a residential room for students at an educational facility. That's the caveat at the end of that. So imagine everything else being offices, small offices, big offices, doesn't matter. Those are all considered public indoor space under this order.
In the Q&A, it specifically calls out if you're not behind a closed door by yourself, you need to wear a mask.
Yeah.
All right. So a reminder, these sessions are every week. Ask your questions, provide feedback, give suggestions. This was great that other people suggested other ways that you could have that conversation. We do these cross-industry. That doesn't mean you can't ask your industry-specific questions, so please continue. We will have specific sessions for certain topics or industries following this one each week. And if you're in that industry, we'll let you know if we make an announcement about that particular subject. Again, thank you for joining us. I'll send out an email with the recording to this, the recording to the Spanish version of this, a recording to the special session that's happening afterwards, all the links that Jesse referenced, including the civil rights guidance for employers and places of accommodation, the sample script, and the mask sign that he did mention. I'm also including information on tracking the Protect Our Neighbors progress in Boulder County, so you can see that firsthand on your own, and any other data sources that help you tell the data story of COVID-19's impact locally and at the state level. If you don't see something that you need, just let me know. We might have it. I just didn't include it in this week's email. And we look forward to continuing to work with the business community as we reopen in a safe manner and continue to try to keep our numbers down so that we can keep business open. Thank you, and we'll see you next week.
Thanks, Corinne. Thanks, Lane. Thank you, everybody.